the underlying principles of both these things is ultimately prevention is better than cure. Okay, so the best treatment ultimately for dentistry is having no treatment. So this is particularly important for kids, and it's encouraging things like brushing the teeth, obviously with fluoridated toothpaste. It's keeping sugars in the diet low, and generally it's about education, particularly of kids, but arguably more importantly adults. Yeah, so if we can educate our patients better, spend more time with them explaining the causes of dental disease in the future, obviously that level of dental disease will reduce. So yeah, hot topic. Go and have a little look at prevention. Again, it's one of those things you can get quite deep into quite quick. So if someone asks you about prevention, make sure you've got 3 things quickly to say. So talk about education, prevention is better than cure, and then you can briefly talk about preventative measures that are in place. So fluoridated toothpastes, reduced dental recalls, things like that. Another topic that ties with prevention is something called minimally invasive dentistry. Again, this is minimally invasive dentistry is a move from historic dentistry, where we were quite destructive with teeth. A good example is a shift from dental crowns. For those of you who don't know, dental crowns are, it's a cap that goes over the tooth. They support the tooth really well. The main disadvantage is that they rely on mechanical retention. So to get this mechanical retention, you have to take a lot of the tooth off. So for example, if you do a full coverage crown, so a crown that goes all the surfaces of a molar, so one of your back teeth, it gets rid of almost 70% of the tooth structure. Okay, now that's a good thing and it'll last a while, but when it fails, the options after that aren't great. There's not a huge amount of options left. So there's been a move from this, what we consider destructive based dentistry now really, to minimally invasive dentistry. And this is the underlying basically principle is that we start sticking things to tooth. So we're relying on adhesive dentistry. So the crown example, rather than taking away all the tooth now, what we do is design something out of the lab that's really strong and it's still fundamentally a cap, but rather than covering it over the tooth, we stick it to the tooth. The advantages of minimally invasive dentistry is that it keeps the options open in the future for future dental treatment. Another thing is, a thing to probably write down is for minimally invasive dentistry, it prevents a commitment to the restorative cycle. Okay, so a restorative cycle is as soon as one person has a filling, they're going to have another filling and then another filling, and then it'll become a crown, etc., etc. If we start with the least invasive, so it takes away the less tooth, we'll have more tooth, and then those options, you have more options available in the future. And that's the sort of guiding principles that we've got. And the reason there's been a move to that is because of advances in dentistry and dental technology, but also on the broader scheme of things, we've got an aging population. So people are keeping the teeth considerably longer than our parents and grandparents. So we want to give them more options in the future. The restorative cycle is basically once you have that one filling, the chances are you're going to need a second filling. Yeah, and you're engaged in the restorative process of dentistry.
Yeah. Once you do any type of dental work, that work has to be maintained. So some people actually say the best dentistry is no dentistry. Exactly. Once we start putting a drill to your tooth, that's not going to last forever. It's going to need maintenance and upkeep, maybe even replacing. So that's lending towards what Stuart is talking about with the restorative cycle. And one of the things that we've seen as dentists is we're removing less teeth. People are getting to old age with their own natural teeth. So back in the past, I was reading this thing where it said that a lot of women, when they were of marrying age, for their present, they got dentures. Their teeth were removed and they got dentures because it was just normal for you to be in your teen years or your early 20s and to have false teeth. So that's one of the ways it's impacted dentistry, all of these advances, the fact that we're removing less teeth, people are holding onto their teeth for longer, and we've got better materials and technologies to achieve that as well. Jake, would you say you've noticed?
Yeah, so I just wanted to finish, I think, give like an example to back up what Stuart was saying, because I think examples are always good, it helps people understand. So minimally invasive dentistry, two like really good examples, which are kind of topical at the moment. You have a lot of, most people would like to have white, straight teeth. You'd all agree that that's what all the patients want, yeah? And there's always two ways of doing, or more than two ways of doing things, but currently you've got a lot of travel tourism. An example comes to mind with Katie Price. She goes away and has what she believes are veneers, but they're not. That it has a full mouth of crowns and bridge work, which, as Stuart said, is really, really destructive. Doesn't always last. When it fails, options are limited. All to achieve straight white teeth. So they basically chop the teeth down, 67% of the tooth goes, and then those crowns, you can make them any color you want, any shape you want. You make them nice and straight, but you've lost a lot of tooth tissue. They will fail after 10 years or so, and whatever's left, you might not be able to put back together again. A really good alternative to that would be straightening your teeth with some braces and then whitening them afterwards, and therefore you've done no damage to your teeth. The risks are much lower. It doesn't preclude any crown or bridge work in the future. I think that, I just wanted to say that to kind of give examples to what Stuart was saying.
Yeah, that's a good reinforcing one. And I think what Jake said there, that could quite easily be an ethical question as well. So with the hot topics and ethics, there's always a little bit of overlap, to be honest. So you could brief, if it's not outlined as a strictly ethical question, you could also mention the ethical considerations in some of the hot topics if it's appropriate. Kelly just asked a quick question about an aging population have negative effect on dentistry. That is an incredibly difficult question, because I wouldn't say there's a negative effect, to be honest. But there's it can make our job a little bit more difficult. In a fit, healthy 80-year-old, the job is exactly the same. But obviously with age, there comes usually more illnesses and comorbidities and lots of people on various medications and things. So does it have enough negative effect? The answer is no. Does it have a differing effect? Yes. You just need to be a bit more astute with things like medical histories and also the wants of the patient. The want of an 80-year-old who can't chew quite right is going to be different to a 20-year-old who can't chew quite right. So negative effect, no. It's just going to have a different effect on your outcomes and your treatment plans. I hope that answers the question. That's quite a difficult question, to be honest.
This lends
sorry, go on.
That dentistry is not about the teeth and the mouth only. You've got to think about the whole body system. Can the treatment that I'm going to carry out be handled by the person behind these teeth, behind this mouth?
Yeah, very true.
The injection I'm going to give to this person, have they got any other medical conditions, which means that this type of injection is not the best injection to apply to them? Can I do certain sorts of treatment on this patient when they're on blood thinners, or they've got gum disease or liver disease, or you've got to think about all these things in dentistry. That's what makes us have a holistic approach to dentistry and not just focus on the mouth and the teeth.
The workshop today really helped me a lot with the interview prep. They gave really constructive comments and very personalized comments as well, so I really enjoyed it.
If you're thinking about studying dentistry, whether you're in college or whether you're in a degree right now, I think just have a chat with them and they will help you from start to finish.